Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX PN Review Lesson 44, 30 NCLEX Practice Questions. You can get my notes on Etsy. Be sure to follow my store to get any updates of new notes. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
The nurse is planning to administer amlodipine to a client. The nurse should plan to check which before giving the medication. A. Respiratory rate. B. Blood pressure and heart rate. C. Heart rate and respiratory rate. D. Level of consciousness and blood pressure. The correct answer is B. Blood pressure and heart rate. Rationale: amlodipine is a calcium channel blocker. This medication decreases the rate and force of cardiac contraction. Before administering a calcium channel blocking agent, the nurse should check the blood pressure and heart rate, which could both decrease, in response to the action of this medication. This action will help to prevent or identify early problems related to decreased cardiac contractility, heart rate, and conduction. A client who has begun taking fosinapril is very distressed, telling the nurse that he cannot taste food normally since beginning the medication 2 weeks ago. Which suggestion would provide the best support for the client? A. Tell the client not to take the medication with food. B. Suggest that the client taper the dose until taste returns to normal. C. Inform the client that impaired taste is expected and generally disappears in 2 to 3 months. D. Tell the client that a request will be made to the healthcare provider to change the prescription. The correct answer is C. Inform the client that impaired taste is expected and generally disappears in 2 to 3 months. Rationale: ACE inhibitors, such as fosinapril, cause temporary impairment of taste. The nurse can tell the client that this effect usually disappears in 2 to 3 months, even with continued therapy, and provide nutritional counseling, if appropriate, to avoid weight loss. Options A, B, and D are inappropriate actions. Taking this medication with or without food does not affect absorption and action. The dosage should never be tapered without HCP approval, and the medication should never be stopped abruptly. The nurse is preparing to administer digoxin, 0.125 mg orally, to a client with heart failure. Which vital sign is most important for the nurse to check before administering the medication? A. Heart rate. B. Temperature. C. Respirations. D. Blood pressure. The correct answer is A. Heart rate. Rationale: digoxin is a cardiac glycoside that is used to treat heart failure and acts by increasing the force of myocardial contraction. Because bradycardia may be a clinical sign of toxicity, the nurse counts the apical heart rate for 1 full minute before administering the medication. If the pulse rate is less than 60 beats per minute in an adult client, the nurse would withhold the medication and contact the healthcare provider. A client who is taking hydrochlorothiazide has been started on triamterene as well. The client asks the nurse why both medications are required. Which response is the most accurate to give to the client? A. Both are weak potassium-excreting diuretics. B. The combination of these medications prevents renal toxicity. C. Hydrochlorothiazide is an expensive medication, so using a combination of diuretics is cost-effective. D. Triamterene is a potassium-retaining diuretic, whereas hydrochlorothiazide is a potassium-excreting diuretic. The correct answer is D. Triamterene is a potassium-retaining diuretic, whereas hydrochlorothiazide is a potassium-excreting diuretic. Rationale: potassium-retaining diuretics include amiloride, spironolactone, and triamterene. They are weak diuretics that are used in combination with potassium-excreting diuretics. This combination is useful when medication and dietary supplement of potassium is not appropriate. The use of 2 different diuretics does not prevent renal toxicity. Hydrochlorothiazide is an effective and inexpensive generic form of the thiazide classification of diuretics. The nurse is caring for a client who has been prescribed furosemide and is monitoring for adverse effects associated with this medication. Which should the nurse recognize as potential adverse effects? Select all that apply. A. Nausea. B. Tinnitus. C. Hypotension. D. Hypokalemia. E. Photosensitivity. F. Increased urinary frequency. The correct answers are B. Tinnitus, C. Hypotension, and D. Hypokalemia. Rationale: furosemide is a loop diuretic, therefore, an expected effect is increased urinary frequency. Nausea is a frequent side effect, not an adverse effect. Photosensitivity is an occasional side effect. Adverse effects include tinnitus, hypotension, and hypokalemia. The nurse provides medication instructions to an older hypertensive client who is taking 20 mg of lisinopril orally, daily. The nurse evaluates the need for further teaching when the client makes which statement? A. I can skip a dose once a week. B. I need to change my position slowly. C. I take the pill after breakfast each day. D. If I get a bad headache, I should call my healthcare provider immediately. The correct answer is A. I can skip a dose once a week. Rationale: lisinopril is an antihypertensive angiotensin-converting enzyme inhibitor. The usual dosage range is 20 to 40 mg per day. Adverse effects include headache, dizziness, fatigue, orthostatic hypotension, tachycardia, and angioedema. Specific client teaching points include taking one pill a day, not stopping the medication without consulting the healthcare provider, and monitoring for side effects and adverse reactions. The client should notify the HCP if side effects occur. A client complaining of not feeling well is seen in a clinic. The client is taking several medications for the control of heart disease and hypertension. These medications include a beta blocker, digoxin, and a diuretic. A tentative diagnosis of digoxin toxicity is made. Which assessment data supports this diagnosis? A. Dyspnea, edema, and palpitations. B. Chest pain, hypotension, and paresthesia. C. Double vision, loss of appetite, and nausea. D. Constipation, dry mouth, and sleep disorder. The correct answer is C. Double vision, loss of appetite, and nausea. Rationale: double vision, loss of appetite, and nausea are signs of digoxin toxicity. Additional signs of digoxin toxicity include bradycardia, difficulty reading, visual alterations such as green and yellow vision, or seeing spots or halos, confusion, vomiting, diarrhea, decreased libido, and impotence. A client is being treated for acute heart failure with intravenously administered bumetanide. The vital signs are as follows: blood pressure 100/60, pulse 96 beats per minute, and respirations 24 breaths per minute. After the initial dose, which is the priority assessment? A. Monitoring weight loss. B. Monitoring temperature. C. Monitoring blood pressure. D. Monitoring potassium level. The correct answer is C. Monitoring blood pressure. Rationale: bumetanide is a loop diuretic. Hypotension is a common side effect associated with the use of this medication. The other options also require assessment but are not the priority. The intravenous prescription is 3,000 milliliters of 5% dextrose to run over a 24-hour period. The drop factor is 10 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute? Round the answer to the nearest whole number. A. 19 drops per minute. B. 20 drops per minute. C. 21 drops per minute. D. 22 drops per minute. The correct answer is C. 21 drops per minute. Rationale: the prescribed 3,000 milliliters is to be infused over 24 hours. Follow the formula and multiply 3000 milliliters by 10. Then divide the result by 1440 minutes. The infusion is to run at 20.8 or 21 drops per minute. The nurse is assigned to care for clients. When planning client rounds, which client should the nurse check first? A. A client on a ventilator. B. A client in skeletal traction. C. A postoperative client preparing for discharge. D. A client admitted on the previous shift, who has a diagnosis of gastroenteritis. The correct answer is A. A client on a ventilator. Rationale: the airway is always a priority, so the nurse first checks the client on a ventilator. The clients described in options B, C, and D have needs that would be identified as intermediate priorities. The nurse employed in a long-term care facility is planning the client assignments for the shift. Which client should the nurse assign to the unlicensed assistive personnel? A. A client who requires a 24-hour urine collection. B. A client who requires twice daily dressing changes. C. A client who is on a bowel management program and requires rectal suppositories and a daily enema. D. A client with diabetes mellitus who requires daily insulin and the reinforcement of dietary measures. The correct answer is A. A client who requires a 24-hour urine collection. Rationale: the nurse must determine the most appropriate assignment on the basis of the skills of the staff member and the needs of the client. The assignment of tasks needs to be implemented on the basis of the job description of the individual's level of clinical competence and state law. Options B, C, and D involve care that requires the skill of a licensed nurse. The nurse employed in an emergency department is assigned to assist with the triage of clients arriving to the emergency department. The nurse should assign priority to which client? A. A client complaining of muscle aches, a headache, and malaise. B. A client who twisted her ankle when she fell while inline skating. C. A client with a minor laceration on the index finger, sustained while cutting an eggplant. D. A client with chest pain, who states that he just ate pizza that was made with a very spicy sauce. The correct answer is D. A client with chest pain, who states that he just ate pizza that was made with a very spicy sauce. Rationale: in an emergency department, triage involves classifying clients according to their need for care, and it includes establishing priorities of care. The type of illness, the severity of the problem, and the resources available govern the process. Clients with trauma, chest pain, severe respiratory distress, cardiac arrest, limb amputation, or acute neurological deficits, and those who sustained a chemical splash to the eyes, are classified as emergent, and these clients are the number one priority. The nurse is assigned to care for clients. When planning client rounds, which client should the nurse collect data from first? A. A client scheduled for a chest X-ray. B. A client requiring daily dressing changes. C. A postoperative client preparing for discharge. D. A client receiving oxygen, who is having difficulty breathing. The correct answer is D. A client receiving oxygen, who is having difficulty breathing. Rationale: the airway is always a priority, and the nurse would attend to the client, who has been experiencing an airway problem first. The clients described in options A, B, and C would have intermediate priority. The nurse has delegated several nursing tasks to staff members. Which is the nurse's primary responsibility after the delegation of the tasks? A. Document that the task was completed. B. Assign the tasks that were not completed to the next nursing shift. C. Allow each staff member to make judgments when performing the tasks. D. Perform follow-up with each staff member regarding the performance and outcome of the task. The correct answer is D. Perform follow-up with each staff member regarding the performance and outcome of the task. Rationale: the ultimate responsibility for a task lies with the person who delegated it. Therefore, it is the nurse's primary responsibility to follow up with each staff member regarding the performance of the task and the outcomes related to implementing the task. Not all staff members have the education, knowledge, and ability to make judgments about tasks being performed. The nurse documents that the task has been completed, but this would not be done until follow-up was implemented and outcomes were identified. It is not appropriate to assign the tasks that were not completed to the next nursing shift. The emergency department nurse receives a telephone call and is informed that a tornado has hit a local residential area and numerous casualties have occurred. The victims will be brought to the emergency department. Which should be the initial nursing action? A. Prepare the triage rooms. B. Activate the agency emergency response plan. C. Obtain additional supplies from the central supply department. D. Obtain additional nursing staff to assist with treating the casualties. The correct answer is B. Activate the agency emergency response plan. Rationale: during a widespread disaster, many people will be brought to the emergency department for treatment. Although options A, C, and D may be components of preparing for the casualties, the initial nursing action should be to activate the emergency response plan. A client has passed away, and the wife of the client tells the nurse that the client is an organ donor and that his eyes are to be donated. Which action should the nurse take next? A. Place dry, sterile dressings over the eyes of the deceased. B. Call the National Donor Association to confirm that the client is a donor. C. Close the eyes, elevate the head of the bed, and place a small ice pack on the eyes. D. Ask the wife to obtain the legal documents regarding organ donation from the lawyer. The correct answer is C. Close the eyes, elevate the head of the bed, and place a small ice pack on the eyes. Rationale: when a corneal donor dies, antibiotic eye drops may be prescribed and instilled. The eyes are closed and a small ice pack is placed on the closed eyes. The head of the bed is raised to 30 degrees to prevent edema. Within 2 to 4 hours, the eyes are enucleated. The cornea is usually transplanted within 24 to 48 hours. Option 1 is incorrect because dry dressings are not applied. Some organ donation protocols indicate using normal saline moistened gauze. Option 2 is not an immediate action. In addition, the client should have a signed donor card, living will, or an organ donor identified driver's license stating his or her wishes. Additional legal documentation should not be required. Agency procedures regarding donor care should be followed. A client tells the nurse about deciding to refuse external cardiac massage. Which should be the most appropriate initial nursing action? A. Discuss the client's request with the family. B. Document the client's request in the client's record. C. Notify the health care provider of the client's request. D. Conduct a client conference to share the client's request. The correct answer is C. Notify the health care provider of the client's request. Rationale: if a client decides to refuse external cardiac massage, the appropriate initial action is to notify the health care provider, because a written do not resuscitate prescription from the HCP must be present in the patient's chart. The DNR prescription must be reviewed or renewed on a regular basis per agency policy. A client who is receiving a blood transfusion rings the call bell for the nurse. When entering the room, the nurse notes that the client is flushed, dyspneic, and complaining of generalized itching. How should the nurse correctly interpret these findings? A. Bacteremia. B. Fluid overload. C. Hypovolemic shock. D. Transfusion reaction. The correct answer is D. Transfusion reaction. Rationale: the signs and symptoms exhibited by the client are consistent with a transfusion reaction. With bacteremia, the client would have a fever, which is not part of the clinical picture presented. With fluid overload, the client would have crackles in addition to dyspnea. There is no correlation between the signs mentioned in the question and hypovolemic shock. The signs identified in the question are indicative of an allergic reaction, which is one type of blood transfusion reaction. A client who was receiving a blood transfusion has experienced a transfusion reaction. The nurse sends the blood bag that was used for the client to which area? A. The pharmacy. B. The laboratory. C. The blood bank. D. The risk management department. The correct answer is C. The blood bank. Rationale: the nurse prepares to return the blood transfusion bag containing any remaining blood to the blood bank. This allows the blood bank to complete any follow-up testing procedures that are needed after a transfusion reaction has been documented. The nurse is assisting with caring for a client who will receive a unit of blood. Just before the infusion, it is most important for the nurse to check which item. A. Vital signs. B. Skin color. C. Oxygen saturation. D. Latest hematocrit level. The correct answer is A. Vital signs. Rationale: a change in the vital signs may indicate that a transfusion reaction is occurring. The nurse assesses the client's vital signs before the procedure to obtain a baseline every 15 minutes for the first half hour after beginning the transfusion and every half hour thereafter. Skin color, oxygen saturation, and most recent hematocrit may be checked but are not the most important. A client is going to be transfused with a unit of packed red blood cells. The nurse understands that it is necessary to remain with the client for what time period after the transfusion is started? A. 5 minutes. B. 15 minutes. C. 30 minutes. D. 45 minutes. The correct answer is B. 15 minutes. Rationale: the nurse must remain with the client for the first 15 minutes of a transfusion, which is the most likely time that a transfusion reaction will occur. This enables the nurse to detect a reaction and intervene quickly. The nurse engages in safe nursing practice by obtaining coverage for the other clients during this time. 5 minutes is too short of a time period, while 30 minutes and 45 minutes are too long of a time period. The nurse takes a client's temperature before giving a blood transfusion. The temperature is 100 degrees Fahrenheit orally. What should the nurse do next? A. The transfusion will begin as prescribed. B. Hold the blood and notify the healthcare provider. C. The transfusion will begin after the administration of an antihistamine. D. The transfusion will begin after the administration of 650 milligrams of acetaminophen. The correct answer is B. Hold the blood and notify the healthcare provider. Rationale: if the client has a temperature of 100 degrees Fahrenheit or more, the unit of blood should be held until the healthcare provider is notified and has the opportunity to give further prescriptions. The nurse is assisting with caring for a client who is receiving a unit of packed red blood cells. The nurse should tell the client that it is most important to report which sign immediately. A. Sore throat or earache. B. Chills, itching, or rash. C. Unusual sleepiness or fatigue. D. Mild discomfort at the catheter site. The correct answer is B. Chills, itching, or rash. Rationale: the client is told to report chills, itching, or rash immediately because these could be signs of a possible transfusion reaction. Mild discomfort at the catheter site may be indicative of a problem, or it could result from the size of the IV catheter required to infuse the blood product. Sore throat, earache, sleepiness, and fatigue are unrelated to a transfusion reaction. The nurse is assisting with caring for a client who has received a transfusion of platelets. The nurse determines that the client is benefiting most from this therapy if the client exhibits which finding? A. An increased hematocrit level. B. An increased hemoglobin level. C. A decline of the temperature to normal. D. A decrease in oozing from puncture sites and gums. The correct answer is D. A decrease in oozing from puncture sites and gums. Rationale: platelets are necessary for proper blood clotting. The client with insufficient platelets may exhibit frank bleeding, or the oozing of blood from puncture sites, wounds, and mucous membranes. The client's temperature would decline to normal after the infusion of granulocytes, if those transfused cells were then instrumental in fighting infection in the body. Increased hemoglobin and hematocrit levels would be seen when the client has received a transfusion of red blood cells. The healthcare provider prescribes 1 unit of packed red blood cells to infuse over 4 hours. 1 unit of blood contains 250 milliliters, and the drop factor is 10 drops per 1 milliliters. How many drops per minute should the nurse infuse? A. 8 drops per minute. B. 10 drops per minute. C. 12 drops per minute. D. 14 drops per minute. The correct answer is B. 10 drops per minute. Rationale: the prescribed 250 milliliter is to be infused over 4 hours. Follow the formula and multiply 250 milliliter by 10. Then divide the result by 240 minutes. The infusion is to run at 10.4 or 10 drops per minute. A client with cancer is admitted to the oncology unit. Stat lab values reveal hemoglobin 12.6, white blood cells 6,500, potassium 1.9, uric acid 7.0, sodium 136, and platelets 178,000. The nurse evaluates that the client is experiencing which of the following? A. Hypernatremia. B. Hypokalemia. C. Myelosuppression. D. Leukocytosis. The correct answer is B. Hypokalemia. Rationale: hypokalemia is evident from the lab values listed. The normal values for potassium is 3.5 to 5.0 milliequivalents per liter. The other laboratory findings are within normal limits, making answers A, C, and D incorrect. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? A. Starting an IV. B. Applying oxygen. C. Obtaining blood gases. D. Medicating the client for pain. The correct answer is B. Applying oxygen. Rationale: the client with burns to the neck needs airway assessment and supplemental oxygen, so applying oxygen is the priority. The next action should be to start an IV and medicate for pain, making answers A and C incorrect. Answer D, obtaining blood gases, is ordered by the doctor. A client has rectal cancer and is scheduled for an abdominal perineal resection. What should be the priority nursing care during the post-op period? A. Teaching how to irrigate the ileostomy. B. Stopping electrolyte loss in the incisional area. C. Encouraging a high-fiber diet. D. Facilitating perineal wound drainage. The correct answer is D. Facilitating perineal wound drainage. Rationale: the client with a perineal resection will have a perineal incision. Drains will be used to facilitate wound drainage. This will help prevent infection of the surgical site. The client will not have an ileostomy, as in answer A. He will have some electrolyte loss, but treatment is not focused on preventing the loss, so answer B is incorrect. A high-fiber diet, in answer C, is not ordered at this time. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated from this client's diet? A. Roasted chicken. B. Noodles. C. Cooked broccoli. D. Custard. The correct answer is C. Cooked broccoli. Rationale: the client with diverticulitis should avoid eating foods that are gas-forming and that increase abdominal discomfort, such as cooked broccoli. Foods such as those listed in answers A, B, and D are allowed. A client arrives in the emergency department after an automobile crash. The client's forehead hit the steering wheel, and a hyphema has been diagnosed. Which position should the nurse prepare to position the client? A. Flat on bed rest. B. On bed rest in a semi-Fowler's position. C. In lateral position on the unaffected side. D. In the lateral position on the affected side. The correct answer is B. On bed rest in a semi-Fowler's position. Rationale: a hyphema is the presence of blood in the anterior chamber. It is produced when a force is sufficient to break the integrity of the blood vessels in the eye. It can be caused by direct injury, such as penetrating injury from a BB pellet, or indirectly, such as from striking the forehead on a steering wheel during an accident. The client is treated by bed rest in a semi-Fowler's position to assist gravity in keeping the hyphema away from the optical center of the cornea.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.